Are there any warning signs I should look out for if I'm concerned about my baby's sensory development? This is a question occupational therapists hear on a regular basis. Today we'll be looking at a few warning signs for sensory processing issues. While every child develops at their own pace, some warning signs that might indicate sensory processing issues or delays in sensory development can include the following. Number 1. Extreme sensitivity. If your baby seems unusually sensitive to light, sound, touch, taste or smell, reacting strongly or becoming distressed in response to normal stimuli. Number 2, avoidance of certain textures. If your baby consistently refuses to touch or interact with certain textures such as fabrics, foods or surfaces. Number 3, difficulty with feeding. If your baby has trouble with breastfeeding or bottle feeding, shows aversion to certain textures or tastes of food, or has difficulty transitioning to solid foods. Number 4, limited exploration. If your baby shows little interest in exploring the environment, seems hesitant to reach for or grasp objects, or avoid new experiences. Number 5, delayed motor skills. If your baby is significantly delayed in reaching developmental milestones related to motor skills, such as sitting up, crawling, or walking. Number 6, overactivity or underactivity. If your baby is consistently moving and seeking sensory input, or if they seem lethargic and disengaged from their surroundings. Number 7, difficulty with sleep. If your baby has trouble falling asleep or staying asleep, sensory issues may be contributing to their sleep disturbances. Number 8, communication difficulties. If your baby has delays in speech or language development, struggles to respond to verbal or non-verbal cues, or has difficulty understanding and following instructions. Number 9, unusual play behaviors. If your baby engages in repetitive or ritualistic behaviors, shows a lack of imaginative play, or has difficulty with social interactions. Number 10, emotional regulation challenges. If your baby has frequent tantrums, meltdowns, or displays extreme emotional reactions that seems out of proportion to the situation. Early intervention and support can make a significant difference in addressing any underlying sensory issues and promoting your baby's healthy development. It's important to remember that experiencing one or more of these warning signs does not necessarily mean there is a problem with your baby's sensory development. However, if you have concerns, it's advisable to discuss them with your pediatrician or healthcare professional who can provide appropriate evaluation and guidance. Trust your instincts and seek guidance from healthcare professionals if you have concerns about your baby's sensory development.